They came by the thousands on buses from across the state, massing on the Capitol's west steps, the largest protest in years, warning of a life or death spiral unless the governor reverses Medi-Cal cuts.
We're looking after the most frail, the most vulnerable. These are people who helped build this state, and now at the very time where they need us, we are in fact pulling the rug out from underneath them.
Very good.
The administration's proposed cuts to Medi-Cal providers adds up to roughly $1 billion, sparking a brush fire of distress across California and a warning that the cuts would shred the safety net.
There's nothing underneath us. We're the safety net. If you take the safety net away, people fall.
For hospitals, the threat is to skilled nursing facilities, which face between a 25% and a 40% cut. The alarm is shared by rural and urban interests, Democrats and Republicans alike.
The message is very simple. We need to keep Medi-Cal reimbursement rates stable so we can take care of basically those in need in California, those most need, our low-income Californians.
We're going to actually provide that necessary funding so that we're actually expand access, and providers will want to provide that coverage.
The targets comprise a map of California. To the north, there is Eastern Plymouth Healthcare, where 96-year-old June Polistrini lives. The prospect of closure haunts her daughter.
They even talked about moving some of the patients down to L.A. I can't even think about it, to shipping her off to L.A. I'd probably never see her again.
To the south, in San Diego County, there is Villa Pomerado, run by Palomar Health, a lifeline for Jeff Olson.
It's scary not to be able to have someplace you can go quickly and maybe get out of quickly and get back on your feet.
In the Central Valley, there is Ralph Need Extended Care Center in Coalinga.
This place is my home. Got nowhere else to go, and neither does half the people.
And along the coast, Hazel Hawkins Memorial Hospital in Hollister.
Couldn't do anything at home anymore without worrying about falling. So my doctor told me, so you better do something. Well, couldn't stay home, so I came here.
Without these facilities, healthcare professionals warn, patients would end up in costly acute care and in emergency rooms, affecting hospitals and access to care across the state. Exactly the opposite of what the federal Affordable Care Act is trying to achieve. The Medi-Cal cuts would be devastating, experts warn, to the safety net and the economy. Learn more at www.caringisourcalling.org.